My name is Matthew Boyce. I'm a movement disorder neurologist and the medical director of the Deep Brain Stimulation program at Chippenham Johnston Willis Hospital. Essential tremor is a common neurologic condition that causes shaking of the hands or the head, sometimes even the legs or the body. But the shaking tends to occur more when people are trying to do something or if they're holding something. It starts very mild and it gradually progresses over time. We do often see it run in families, and it can respond to prescription medication, but over time, as I said, it does gradually get worse and it can start to impair people's function, their ability to do things. More commonly, what we do is a technique called deep brain stimulation, and what this technique allows us to do is to target that same area of the brain with electricity so that we're not actually causing any damage to the brain, but we're stimulating that circuit that's involved in the tremor, blocking that circuit and alleviating the tremor.
It's Peggy Kosminski. I've had them since I was 3, and over the years I learned to compensate to be able to do things my own way, I guess, instead of what I guess you would call the normal way.
Mrs. Kosminski first came to see me because she was frustrated with her tremors. She'd had them for a long time and she'd already tried all the available medications, and she was looking for another option.
When I eventually came to the realization that something had to be done because I felt like I was existing and not living. It's a horrible feeling to wake up some morning and just realize that you are here and you can't do anything for yourself. It all has to be done for you instead of you being able to do it yourself.
So deep brain stimulation is a surgical procedure. It does involve the placement of a wire or an electrode into the brain. So I often use the analogy of it's very similar to a pacemaker, a cardiac pacemaker, where wires are placed in the heart. They're connected to a battery source. Everything is internal under the skin. So very similarly, a wire is placed into the brain. They do have to come in about a week or 2 later for an outpatient procedure that takes a few hours to connect that wire to the generator. But like I said, they'll go home the same day after that procedure and are pretty much back to their normal function.
I was a little worried. You know, when they tell you that you're going to have brain surgery, that you kind of have to put your mind at ease to that point. But if you come to the realization that this is going to be a life changer for me, it was easy for me to kind of put my mind at ease that I was in good hands.
It really is a remarkable experience to be in a room with a patient who has a deep brain stimulator in place, because they walk into the room with oftentimes severe tremor, and just by communicating with this device and setting in the right parameters, they may walk out of that office visit with little to no tremor at all, just within a matter of a few seconds in some cases. Tremor is a very responsive symptom to deep brain stimulation. It reacts immediately, so you see the clinical effect in front of your eyes.
I can't tell you what I felt emotionally. It was just fantastic. It's changed my life a lot, that I can now do things that people don't have to adjust their schedules to be able to do things for me. I love to sew, so I can sew again. I can do embroidery. I can sew on the sewing machine again. I can thread a needle now. Because it gives you a new lease on life. You'll be able to do things for yourself that you've never been able to do easily and comfortably and enjoy doing them. I was very excited to be able to get it done. I was looking forward to being a normal person again, being able to do things for myself and go places I want to go and just do things.